how our medical system is broken from the eyes of a person with a chronic illness. When dealing with a chronic illness, it's never easy. However, our medical system makes it even harder. Doctors seem to only deal with what's in front of their face. It makes sense when you go to a specialist that they will only deal with what they specialize in. The downfall is when you have a chronic illness and go to that specialist. Any problem you may have automatically is put under that umbrella, that illness. If it is noticeably not that illness, then they can not do anything about it. Very rarely do they recommend someone who can do something. If they decide that it is under that umbrella, they add more toxic medications and increase ones you are on that cause more severe side effects to band-aid the problem that they feel fit under their specialty. If you have had an extremely bad reaction to a medication, I say extremely because other than that, they tell you just to deal with the reactions and side effects. They take you off it and then increase a medication you're already on that will increase those side effects. Or even worse, say there's nothing else they can do. It seems like they have a handful of different kinds of medications that they just keep cycling through. Then if the patient can't tolerate one or has a really bad reaction, it gets put on the patient like they did something wrong. It's even better when they get through the whole cycle of medication, so their answer is to put you back on one that you've already not been able to take without those reactions. They warp it by saying, maybe now you won't have that reaction, but if you do, there's nothing else we can do, forcing you to either deal with horrendous side effects or live with your disease out of control. Anyone who has been diagnosed with a chronic illness may also have seen the diagnosis process be skewed by you having a chronic illness. Any complaints or issues are automatically put under the diagnosis of that chronic illness. They rarely look further. They rarely take into consideration that it may not be related to the illness or that the illness has triggered other issues that need to be treated differently. So they increase or put you on more toxic medication for your illness that you get to deal with the side effects but do not actually relieve the problem. Then, well, your illness seems to be under control, so it's either in your head or there's nothing they can do for it. Most spend less than 10 minutes in the room, get paid by the insurance for the hour, and resolve nothing but can say they tried, as if we were paying these doctors to use us as guinea pigs and our voice does not matter. One of two things can happen after these situations. The first is that you have dealt with so many failed treatments, you either pinpoint the issue yourself or go into fight mode, determined to get an answer. You scour the internet trying to find a doctor who may be able to help, or at least be able to find the real problem so you stop getting the wrong thing treated. The downfall to this is, unless you have at least one doctor that listens to you, most of the time you need a referral to get into the new doctor. If you actually are able to get the referral, go to the doctor and find out what the new issue is. Either they treat it, which is very rare, or get another, there's nothing we can do now. Usually because the issue was overlooked for so long, it's too late to do anything. Then they still don't communicate to your other doctors, or if they do, the other doctors don't read it or apply it. Then you're still out of your mind to the original doctor who wanted to put it under the chronic illness. The second thing that can happen is you begin a cycle of giving up. This leads to depression and the inability to deal with any of your disease rationally. Now, some may look down on people who go the second route, except you may have already tried the first route multiple times and are tired. You have asked for help over and over and gotten the revolving door of toxic medications and the doctor standing in the room for 10 minutes making assumptions, not listening, and not giving any real resolutions. Now the doctor's answer to everything is that you're depressed and need to go to counseling. You obviously need to talk to someone about being depressed. Also, the depression will eventually be the answer to any other issue you may be having that they cannot find real solutions to. So you go to the counseling so you can release your frustration and help your depression. Except the real reason you are depressed and what's causing you to spiral has not been resolved. Even if you work through your depression, you're going right back into the room for that doctor to not have any solutions. Counseling and therapy is always a good idea for anyone with a chronic illness to help them deal with their change of life. However, it is used more for a solution to the doctors not finding and fixing the actual problems. One of the biggest problems and issues with most chronic illness is managing the pain that comes with it. There are over-the-counter medications, ibuprofen, acetaminophen, creams, patches. However, they usually either don't work or will react to the prescription medications you are on, making them even more dangerous than prescriptions. A few other options will include what is called tramadol and shots of steroids directly in the affected area. Tramadol is a non-narcotic option. When combined with acetaminophen, it can be really strong. Also, if you're on medications that use your liver, you cannot really add acetaminophen because of the possible liver damage. Downside to this drug is it can cause complications if you have heart issues, can cause pain, which to me seems counterproductive, and numbness, tingling, can cause severe anxiety, and people who have mental instability can have even worse reactions. Basically, as long as you don't have any of these side effects, this works. If you have those side effects, you end up decreasing your quality of life instead of helping to increase it. Cortisone shots can be very effective. Many people with certain injuries benefit a lot from them. However, because of the long-term side effects, they are limited. Unfortunately, if you have a chronic disease that affects the majority of your body, you're more than likely not going to be able to get shots everywhere on your body. So you have to pick out what are the most difficult to deal with and get the shots there. You have to know that it's not recommended for more than 4 times a year because of the permanent damage it can eventually cause. Next, we will discuss opioids. Honestly, many people already know the negativity that comes with anything in the opiate family. There are chances for increased tolerance and addiction. This is how the doctors I have seen are pretty much divided into 2 categories. The ones that overprescribe and the ones that all but need an act of Congress to prescribe them. The doctors that overprescribe usually attract the patients that know how to work the system and get the opiates higher in strength. They usually sell the extra they don't need or take them and eventually build a tolerance or get addicted. There are, of course, exceptions and, of course, patients that truly need the higher amount. However, in my experience, that group of doctors tend to go to the higher opiates right away, meaning the patient is going to have a higher tolerance sooner and need to be able to battle the chronic illness for years to come, leaving them with less and less options once they're farther into their disease. I know there are other pain medications, but most have similar issues to the ones I have already spoken about. The opposite scenario is the doctor that's almost afraid to prescribe anything in the opiate family. You are in constant pain and the other pain meds are not an option. It's a long drawn-out process to get a script of 30 of the lowest dosage of the lowest in the opiate family. A better way to understand this is to remember that the average opiate lasts about 6 hours. That means you have to make a conscious decision on what 6-hour period, on what day, to you is more important to get the relief. You have to decide if being able to walk during the day is more important than being able to sleep at night. Then after years of making those decisions, your tolerance gets higher, not because you were abusing them, but because it just happens. Also, your chronic disease is becoming more aggressive. So the opiate is now working less against more pain. This kind of doctor will definitely not increase even the quantity, never mind the dosage, for any reason. Some is due to laws that have passed. They are more based on the lower opiates, and these laws usually make it increasingly more difficult for the people following the rules and trying to not heighten their tolerance too quickly to be able to get what they need. These laws are specifically made because of addiction and overdose epidemics that involve higher opiates and street drugs but end up completely counterproductive. That's a different rant for another day. Some like to go the route of natural vitamins and supplements. You still need to be careful that these do not counteract any medications that are used to control your chronic illness. Also, that they don't cause negative side effects when combined with your other medications. If you happen to find one that helps, but you need to ask your doctor about combining them with your daily routine, you usually get 1 or 2 reactions. Either they say go ahead without trying to actually determine if there's possibly going to be an issue, since they don't want to go over their 10 minutes they are with you even though they get paid for an hour, or they automatically dismiss it and say you're wasting your money. This leads me into the other possible issue. Most prescription coverage will not cover these natural alternatives, so they can be unaffordable. A great example is that when a patient goes on methotrexate, they must take folic acid to avoid severe side effects and sickness. Even though it is known that you need to take it, you go to the pharmacy and your coverage does not cover it, so you have to pay full price for it. This is them knowing you have to take it because of the medication side effects, but it doesn't matter to them. They consider it optional. I could have a rant about prescription and health coverage too, but I'll save that for another time. The final option that is available is cannabis. It's becoming increasingly more popular and more studies are coming out showing what benefits come from it. There are many options now that include not just smoking it, but taking it by pill form, oil, or edibles. The downside is that it's more of an obvious high. I have noticed people with children or who have certain responsibilities are more likely not to use it for fear of delayed reactions. There are kinds that won't get you high, but tend to be more difficult to find. It's not a miraculous drug, but is known to help a lot of different issues. The downsides, besides difficulty finding the kind that won't get you high, is the cost. I will honestly say I'm not familiar with every state's rules and costs, but if you have to pay for the license, doctor's appointments, follow-up, etc., it gets expensive fast. The cost of the actual products to maintain relief can be astronomical depending on your financial situation. You also need to take into consideration the scrutiny that you'll get from the doctors that don't believe in it. The moral of the story is the health system is beyond broken. People are forced to rely on doctors who only see what they want and are stuck in a box of what they like to prescribe. They overprescribe something, just plain refuse to prescribe others, and look down at alternatives. The people that do not need that much help get more help because their answers are easy. The people that need the most help do not get it. If the problem is beyond what the doctor is willing to deal with, they tell the patient there is no help. Health/prescription coverage does not cover majority of the options. Most people with chronic illness cannot work, or their work is constantly interrupted by health issues, so their income cannot cover options that may genuinely help. By the end of the situation, it falls on you, the patient. You're the one that has had the bad reaction. You're the one that cannot handle the regimen they decided is what you need. It is your fault if the things do not work. It is your fault if you get depressed and overwhelmed by hopelessness the 20th time you get told there are no other options for you. Doctors get paid a substantial amount of money to not help you. Just know you are not alone. The sadness, frustration, and hopelessness is not your fault. It is because of a system that cares more about profit and looking good than actually helping people. You are not the problem if a doctor chooses to only use a set way on how to treat a problem and not look outside that box. In other words, the health system sucks.